So what I'll be talking about today is what is the cancer education course for Aboriginal health professionals, a little bit about our evaluation methods for the cancer education course, a little bit about our evaluation results and what sort of direction we're heading into for the future. So in 2005, the Cancer Council WA submitted a submission, a call for expressions of interest to consult and assist them to improve access and service delivery to Aboriginal and Torres Strait Islander people. The following year, Dr. Sandy Thompson and colleagues submitted a report to Cancer Council WA outlining recommendations for improving cancer-related services for Aboriginal people. Two of Sandy's recommendations from the report were to awareness raising, education and training of Aboriginal people about cancer, and to establish and formalise relationships with Aboriginal organisations locally. And at this point, I'd just like to talk a bit about what would have been on my presentation slides. And to thank Cancer Council Queensland, who established a cancer education course before we began our course in WA. So it was through their help and support that we started our cancer education course over there. So there you go, that's the Queensland Cancer Council's cancer education course. And before our course started, we sent a worker over to attend the cancer education course here in Queensland and to really learn in depth how they run the course and what sort of processes were involved, so that would help us with setting up the cancer course back in WA. And with the establishment and formalisation of relationships with Aboriginal organisations locally, this led to us developing the Cancer Council WA's advisory group, and they gave us really great feedback and input into developing the cancer education course. So it's really important to work in with the local organisations in your community when you're thinking of starting up a course, so that you've got as much feedback as possible. So what were our objectives? We wanted to increase cancer knowledge and increase awareness of the resources and services available to help Aboriginal people with cancer and their families. And we really found that and believe strongly that health professionals who attend the course have frontline access to the communities in which they live and work, and are better able to educate and increase understanding of cancer through all stages, from prevention and lifestyle risk factors through to early detection, treatment, remission and palliative care. So the cancer education course is conducted over a 5-day period with funding secured to ensure that there are no out-of-pocket expenses for students who come along and do the course. And by the end of the course, students are able to describe ways of relating to patients and their families at the time of cancer diagnosis, have a better understanding of what cancer is, the causes of cancer, the different types of cancer, cancer treatments and side effects, tests and investigations to diagnose cancer, which we've heard quite a bit about in previous sessions. By the end of the course, they should be able to discuss the impact of cultural beliefs in relation to cancer and ways we can use Western medical models to support Aboriginal and Torres Strait Islander people with cancer. They should also be able to describe supports and resources that are available for Aboriginal and Torres Strait Islander cancer patients and their families, develop a range of networks to support Aboriginal and Torres Strait Islander health professionals and people with cancer, their families and their friends. Ensure that information learned is provided to patients and their families with respect, care and concern. Explore ways to educate families about cancer, have a better understanding of prevention, screening and early detection and resources to promote these in the community, improve knowledge about palliative care, improve knowledge about grief and loss, and have a better understanding of research about cancer in Aboriginal and Torres Strait Islander people. So it's important to incorporate different ways of learning into the program so that the information obtained throughout the course can be more readily recalled. It makes for a more interesting way of learning throughout the week, I think. So with the, just here, the different types of presentations and workshops that we have throughout the 5 days of the course, that I think it's a really interesting way of providing the information to the students while they're there for the 5 days. There are some sessions where it isn't possible to have Aboriginal presenters, and in these instances it's important that the presenters have experience working with Aboriginal and Torres Strait Islander people and are known to be culturally aware and respectful when they're working within the Aboriginal community. And it was also really important for us, I think, to have some feedback from representatives of our advisory group attend the pilot cancer education course, because they gave us really great feedback that helped with sort of changes to the course for future courses. So for process evaluation, each day of the course was evaluated with feedback from the students on each presentation that was given throughout the day. So this is how we sort of got back the statistics and numbers to evaluate the process. Impact evaluation, pre and post course, and a follow-up at 8 months with a range from 6 to 10 months to get in contact with the students after the course. It was assessed with the 5 confidence items and 5 knowledge items using a 4-point Likert type scale. So this was mainly to look at changes in students' confidence and knowledge before and after they'd attended the cancer education course. So this is just a look at our evaluation form that we send out for people to, our application form for people to apply to come along to the course. So we've held 9 courses since 2008, 7 metro, 1 metro regional, so that was held in Perth and in Albany in the Great Southern region of WA. And 1 regional course which was run over 3 days in Broome in the north of Western Australia. So that was a lovely time of the year to make an escape from the cold weather in Perth, I think. Yeah. So we've had 107 Aboriginal health professionals attend the course. The reason why we call the course a health professional course is a lot of people would ring and inquire about if it was just for Aboriginal health workers when it was called an Aboriginal cancer education course for Aboriginal health workers. So we changed it to health professionals to be more inclusive of other people that would like to attend the course. So most of our students are from rural and remote WA, so we get a great group of people that come along and do the course. And based on 2006 statistics, this is 25% of the Aboriginal health workers in WA that have come along and done the course, so we're really happy with that it's getting a great sort of representation from the Aboriginal health workers also. So the program content evaluated well. Most responses were good, excellent, or partially entirely relevant. I don't really need to tell you much about our evaluation results. Here's the questions that are asked here, the confidence items. So this is how we measure pre and post course, we evaluate how things have changed for the students before they've come along and done the course and after. So, and these are the knowledge items that they should be, working out whether they've got a lot of good information from the course over the week and sort of what sort of knowledge they've gained from coming along and doing the course. And at that, I think we might leave it here for now. So there's not much else that I need to talk about with the. It's mainly just evaluation, and thank you.